I am Dr. Vikram Kolhari. I am a Consultant Cardiologist at Apollo Hospitals Sheshadripuram. So today we'll discuss about different presentations of coronary artery disease. Coronary artery disease means blockage inside the coronary arteries. The coronary arteries are the blood vessels that supply blood to the heart. So whenever there is blockage inside the coronary artery, there is reduced blood supply to the heart, which may present as angina or chest pain, or in most severe form it can present as a heart attack also. Coronary artery blockages can present in various ways. They can be asymptomatic for a long time. Patient may have blockage but may not present with any chest pain, any breathlessness, or any symptoms for that matter. So this is called as asymptomatic coronary artery disease, and you might be surprised to know that almost 15 to 20% of heart attacks patients may not have pain. So that is more commonly seen in patients who are diabetics or who are elderly patients, where the pain receptors are affected and they do not feel the pain sensation, and even heart attack can be there without having a chest pain in such subset of patients. The classic symptom of coronary artery blockage is angina. It is generally the chest pain that presents in the center of the chest, and this pain can radiate to the left arm and it can radiate to the neck as well as jaws. And the pain usually comes when patient walks or exerts themselves, and it is relieved by rest or taking certain medicines like nitrates. The pain is variously described as heaviness, squeezing, tightness, or even burning sensation inside the chest, and may be associated with sweating, and there is a sense of impending doom that can be associated with this particular kind of pain. Whenever the pain comes on exertion and is relieved by rest, we should be a little careful, and it may be a presentation of angina. The more severe form of angina is heart attack. When patient starts developing chest pain or chest discomfort associated with sweating, when present at rest and when presents for a longer period of time, say 20 to 30 minutes or more, it may present heart attack. And in heart attack, it is absolutely essential that we recognize the symptoms early, we do the relevant tests, and like ECG, the blood, the cardiac enzymes, and echocardiography, that gives us the diagnosis of heart attack. And in heart attack, it is utmost important that patient is immediately given the blood thinners and taken up for a definitive procedure, that is primary angioplasty. Another mode of presentation of coronary artery blockage is sudden death. Many a times we see that a patient goes to sleep in the night and do not get up in the morning. That is the most severe form, wherein patient might have had a heart attack during night and they may have sudden death because of arrhythmias. So these are the various modes of presentations. Patient can be asymptomatic, they can have effort angina, they can have a heart attack, that is the pain present at rest, and another mode of presentation is sudden death as well. It is very important to differentiate the anginal chest pain from the pain that comes because of gastritis. Many a times patients confuse for gastritis, and they might not seek medical attention, which delays the diagnosis and worsens the prognosis of patients. Generally, there are many atypical presentations of anginal pain or chest pain, anginal pain or heart attack as well. Sometimes patient may not have chest pain but can present to us with breathlessness, loss of consciousness, excessive palpitations. Some of the patients can present with back pain and even loose stools with abdominal pain. So these are various atypical presentations that can be there with patients who have coronary artery blockages. So when patient has gastritis, generally it is associated, it is usually a burning sensation, can be associated with vomiting, and generally the symptoms are not exacerbated by exertion. However, there is no 100% demarcation, or nobody can be 100% sure whether the pain is because of gastritis or pain is because of angina. So it is very important that we do relevant tests, take proper opinions, do the ECG, echocardiogram, if required treadmill test, in order to diagnose angina. Thank you.